Hello everybody. Today we will see hyperbaric oxygen therapy and its uses in medicine. What is this hyperbaric oxygen? How it is given? Why it is given? And what are the conditions where it can be given? So greetings from Nagpur. Hyperbaric oxygen therapy is the medical use of the oxygen in pressurized environment at a level higher than 1.1 atmospheric absolute ATA. ATA is the unit of pressure. Increased pressure allows the oxygen to dissolve and saturate the blood plasma. Normally, the blood plasma doesn't have much oxygen, but when the oxygen is going into the plasma at a higher pressure, it will dissolve into the plasma at higher concentration than the red blood cell hemoglobin corpuscles. So, this non-invasive therapy is most trusted way to increase the oxygen levels to all the organs of the body. The typical treatment lasts for 60 to 90 minutes, during which the patient lies down and breathes normally. If we see the brief history of HBOT, it all started in 1662, the British physician to treat the pulmonary disease and help with the digestion. In 1891, the US doctors began to treat nervous disorders with the HBOT. In 1895, it was found to be effective in treating carbon monoxide poisoning. So that was the first proper indication of hyperbaric oxygen therapy, and this was detected way back in 1895. So gradually it all developed, and in 2000 hyperbaric medicine was approved by American Board of Medical Specialties as a subspecialty of the emergency and preventive medicine. These were the initial chambers. Almost 5-story steel ball makes novel hospital, and huge size oxygen chambers were there. Very cumbersome to use. Now we will see how much the oxygen pressure affects the dissolution of the oxygen into the plasma. When the pressure is 180 A, the plasma has less than 50 oxygen level. But as the pressure goes on increasing at 3 atmosphere 80 A, the oxygen which is dissolved is more than 350 ml, and the therapeutic which we give at 1.7, it is more than 150. So as the pressure increases, the dissolution of the oxygen in plasma increases. The oxygen is carried in blood mainly by hemoglobin and plasma, as everybody knows. Hemoglobin carries majority of the oxygen. Plasma carries only a minute amount of the oxygen. When we normally breathe air with 21% oxygen at sea level pressure, the most tissue need oxygen are made from the oxygen combined with hemoglobin, and which is 95% saturated. 100 ml blood carries 19 ml of oxygen combined with hemoglobin, and only 0.32 ml is dissolved in the plasma. So 1 gram of hemoglobin carries 1.34 ml of the oxygen. So all these figures are very important to understand the future of future slides. The 15 gram of hemoglobin can carry 20.10 ml of the oxygen. Even if we increase PO2, HB can't carry more oxygen as it is 100% saturated. So what is remaining? The plasma is unsaturated. So plasma is available for us, so that the oxygen is dissolved in the plasma, and that is done by the high pressure hyperbaric oxygen therapy. So at normal air, the capillary pressure of the oxygen is 50 millimeter of mercury, but at 1.3 atm it is 246 millimeter of mercury, and at 100% oxygen at 1.5 atm it is 437 millimeter of mercury PO2. So you can see almost 9 times the oxygen is dissolved as the pressure increases by zero point 0.5 atm. This is a very good slide where you can understand that this is the constriction in the blood vessel and the RBC can't travel across the constriction. So this is the stricture there in the blood vessel, and the oxygen is not carried beyond that particular obstruction. So when we increase the plasma, that plasma pressure, oxygen pressure, then the oxygen will be carried to the oxygen deficit area. And under this hyperoxic condition, after few sittings, there is a stimulus for the neovascularization. So new blood vessels are formed and plasma can carry 100% oxygen under pressure, and extra oxygen is diffused into the tissues from new blood vessels. So these new blood vessels will take over the blood supply across this obstruction in the blood vessel. This is one beautiful diagram which denotes that under the influence of HBOT, how much blood vessels they regenerate or neovascularization it occurs. So what is the mechanism of HBO therapy? The oxygenation of the ischemic hypoxic tissue occurs. The neutrophil oxidative killing function improves. That means the WBC of the body, they work in better way. There is suppression of the multiplication of the bacteria. The antibiotic effectiveness increases, and there is enhanced fibroblastic action so that the scarring or healing of the tissue is more. And as we have seen, there is angiogenesis, neovascularization. So new blood vessels, new blood supply, more nutrition, more oxygen. So that is the mechanism of HBT. So what are the indications which are approved by US FDA? These are air or gas embolism, carbon monoxide poisoning, gas gangrene, myositis, myonecrosis, crush injuries, acute ischemia of the limb, decompression sickness, the arterial insufficiencies, diabetic foot ulcer. This is a big indication for the hyperbaric oxygen therapy. Thermal burn injuries, idiopathic sudden sensory neural hearing loss. Then some other indications are intracranial abscesses, necrotizing soft tissue infection, and delayed radiation injury. The radiation colitis, radiation cystitis, they can also have good results of the hyperbaric oxygen therapy. And compromised skin grafts and flaps. So these are the various indications approved by the US FDA. In gas gangrene, it will decrease the level of amputation, it will decrease the efficacy of the clostridial toxin and clostridium bacteria, and thereby the length of the limb is saved, progression is halted, high oxygen tension inhibits clostridial toxin, reversal of hypoxia induced neutrophil dysfunction can be there, and enhanced macrophage interleukin 10 expression is there. Anti-inflammatory effect of HBOT is also seen. In crush injuries, damage related to the crush injuries include bleeding, bruising, compartment syndrome, fractures, laceration, nerve injury, devitalized tissue is more in crush injuries, and all this can lead to secondary infection. So all these things they are prevented, or the type of injury and the level of injury is decreased by giving hyperbaric oxygen therapy to such patients and doing early repair. In thermal burns, the flame, scald, the contact burns, electrical burns, radiation burns, and chemical burns. Again, it is a good option. Early healing is there. Necrotizing tissue infections caused by streptococci. We will see one of the patient's photographs. Necrotizing fasciitis with bleb formation. We did proper debridement, fasciotomy because of the compartment syndrome. These patients they improved rapidly. You can see the multiple islands of the skin are formed, and the quality of the skin is far better than the non-HBOT patients. So very good granulation formation is there, red because of the neovascularization. So these patients they can go in for early skin grafting. So these are the few pictures. Then coming to the osteomyelitis, osteomyelitis usually begins as an acute infection, but it may evolve into a chronic condition. Osteoblast and osteoclast production improves and faster regeneration of bone occurs under the influence of hyperbaric oxygen therapy. It is also useful in cardiology. This is a completely separate topic, HBOT and cardiology. We will see it somewhere, sometimes, but there is decreased reperfusion injury. It stimulates angiogenesis and potential collateralization of the blood flow, and so on. So all benefits of HBOT are seen in cardiological practice. There are various papers where there is a surprise that this hyperbaric oxygen therapy improves the outcome after the heart attack. So it is also helpful in the cardiology, this hyperbaric oxygen therapy. There is evidence that people with acute coronary syndrome are less likely to die or even have major uh, adverse event, and to have more rapid relief from their pain if they receive hyperbaric oxygen therapy as a part of their treatment. Even post cardiac arrest resuscitation, because of the use of defibrillation, these patients they have better outcome if they are given hyperbaric oxygen therapy. So in diabetic foot ulcer, they are common complication of poorly controlled diabetes forming as a result of skin and tissue breaking down, and there is a wound formation mostly at the pressure points because of the diabetic angiopathy, diabetic neuropathy. Then these HBUT causes angiogenesis, collagen deposition, reepithelialization, and there is early healing of the diabetic foot. Even the toes and the limb can be saved because of the hyperbaric oxygen therapy. So these are the various papers which are available in literature supporting this particular document. We will see some pictures. You can see diabetic foot with a wound there, and post 20-25 cycles of the hyperbaric oxygen therapy, improvement in the wound. This is also a second example, improvement with 20 HBOT cycles. Here you can see a beautiful picture. Patient's third toe is almost impending gangrene. We subjected the patient to HBOT, the wound became red, and even the third toe was saved. No further debridements were needed, and patient was subjected to plastic surgery with saving of the remaining three toes. So the quality of life improves after chronic diabetic foot ulcers because of the hyperbaric oxygen therapy. In dermatology, definitely there are various cosmetic effects of the hyperbaric oxygen therapy, but in some diseases also, such as chromoblastomycosis, there is rapid resolution of the condition. This condition is known to be there for years together, decades together, but this particular condition improves with the help of hyperbaric oxygen therapy. A Steven Johnson syndrome patient, almost 100% burn, improved immediately. On 8th day, patient was without any dressing. The scars also improved. The Fournier's gangrene and the perianal sepsis. 11th day, under the influence of the hyperbaric oxygen therapy, rapid regeneration of the tissues. In diffuse axonal injuries, the patients improved earlier recovery with normal brain functions are there. On 18th day, that particular child improved with alert look, no tracheostomy now. Okay. And he was communicating. Yeah. Yeah. This particular young boy, exam appearing, hanged himself almost 3 years back, was vegetative for almost 3 years. His father did everything to make him survive. We started HBOT in December 2017. Severe contractures, rigidity, no pain perception, loss of fat, muscle atrophy, no bladder and bowel sensation. This was the status in this particular young boy, and when on 21st day he gained fat, appetite improved, contractures decreased, early neurological reflexes they started returning. In February, he was given 3 days in a week hyperbaric oxygen therapy. He was holding neck, maintaining posture. There was purposeful look, but still the neck is stiff. Contractures they started getting released. The emotion started, the neck movements returned, contractures decreased, localization of the pain returned, and bladder and bowel movements recognition was there. He was trying to speak. There was cough reflux. You can imagine the day one and today's date. So, in hypoxic brain injury, this is also useful. If the neurological damage is not there much, then this can be very helpful in many patients. In autist patient, there is lot of research on hyperbaric oxygen therapy. These autist patients, they have a tendency of hepatomegaly. This hepatomegaly also decreases after HBOT. The coloring, the recognition of the borders, proper coloring at proper site improves, and HBOT at pressure commonly used in children with autism has been reported to improve cerebral perfusion, decrease the markers of inflammation, and not worsen the oxidative stress markers. So, the effect of hyperbaric oxygen therapy on nervous system, there have been multiple researches and multiple scientific papers. Even in cancer also, hyperbaric oxygen therapy works well. There are few conditions where it is contraindicated. We will see in a different lecture how this hyperbaric oxygen therapy and cancer go hand in hand. What are the indications, what are the contraindications, how many cycles it is to be given, when exactly the HBOT is to be started, uh, concurrent with the chemotherapy or radiotherapy, or after chemotherapy and radiotherapy, that we will see in detail in the next lecture. Thank you very much.